We have some news right now. RFK Jr. is launching an effort to create a nationwide database to track individuals with autism and is using private medical records to get it done. According to latest reporting, the National Institutes of Health is helping to collect the private medical records of thousands of Americans across the country from both government and commercial databases to give to the Department of Health and Human Services so that RFK can create a registry of people with autism in the United States. The records include prescription records from pharmacies, lab testing, genome records from the Department of Veterans Affairs and Indian Health Services, private insurance claims, and data from your smartwatches and fitness trackers. It's also working on an agreement to secure Medicare and Medicaid data. Yes, this is real. The federal government is about to track you if you have autism and use your smartwatch to do it. I'll have a full breakdown on my Substack, link to my bio, so subscribe for free, spread the word, and follow along for all the news you need to know about. More to come.
Department of Health and Human Services just announced that they're creating a new disease registry to track Americans with autism. Following RFK's announcement that he is determined to find a source that is causing autism in our children, the National Institute of Health is amassing private medical records from a number of federal and commercial databases to give to Health and Human Services. The data they are collecting include medication records from pharmacy chains, lab testing and genomics data from the patients treated by the Department of Veterans Affairs and Indian Health Services, claims from private insurances, and data from smartwatches and fitness trackers. The NHI is also in talks with Centers for Medicare and Medicaid Services to broaden agreements governing access to their data, and here is where they announced that a new disease registry is being launched to track Americans with autism, which will be integrated into the data. In addition, Health and Human Services plans on giving this data to between 10 and 20 outside groups of researchers who will be given grant funding and access to all of the records to produce the autism research.
If you're in the United States, you've been thinking about getting an autism diagnosis, maybe you're actually on a wait list waiting for your assessment, I would maybe put a pin in that idea right now. RFK Jr. wants to create a registry tracking autistic people. Now, I've seen comments on this. He is very clear. This is not like, I want to gather numbers about autism so we can study those numbers. They want to cull private medical records and put the names of individuals on a list so that they can track these individuals over time. That is so wrong and so terrifying on so many levels. So unless you have a need, like a very specific need where you need it documented for the sake of like Social Security disability or maybe workplace accommodations, even then I would think twice about it right now. But unless you absolutely need your diagnosis documented on paper, I think for the foreseeable future, it might not be worth the risk, because I don't know about you, but I do not want my name on a list of disabled folks that is being held by and studied by and monitored by this particular government. So do with that what you will. I just want you to be aware that the US is up to even more shady shit.
Making autism registries, that way people stop going to get diagnosed. So that way when the numbers fall, they can claim they've cured autism.
Say sorry, honey, but you never really show me. And I can leave the party without ever letting you know. Without ever letting you know. Rufus, oh, you got me love, oh, you watch his own.
In addition, a new disease registry is being launched to track Americans with autism, which will be integrated into the data. This is alarming on many levels. If you want to get more precise in your data around autism to continue learning about it because there are still so many unknowns, I could get behind that. But when you call it a disease registry, that's when I get extremely concerned. This is not about helping autistic people. It's about fixing them. I'm disturbed, disgusted, and frankly, extremely afraid of where this is going.
For the record, RFK Jr. just announced he wants to collect the autism status of millions of Americans and then share that information with 10 to 20 private companies, research organizations. I only put air quotes around research organizations because while that is what they are, I think what they really are in this case is a walking lick waiting to happen. At best, and that's assuming the best intentions. But in this day and age, I think it's so important to remember that information is traded like oil, like diamonds, like any other resource. To hand this information over to all of these companies without consent from Americans is absolutely insane, especially when RFK is trying to lead the NIH on this crusade to pathologize autism. And more pointedly, in this administration's fashion, to pathologize autistic people. And when this information gets leaked, and it's when, not if, it will be so hard to quantify what the consequences even are, especially as this administration continues to warp the conversation around autism. As is the case with so much of your leaked information that you are not privy to, you won't even know if that's a factor playing into how your life is going. Like, you could go for a job interview and you're rejected on the basis of the fact that they know your autism status. That was good, man. And you would never be the wiser.
RFK Jr. is trying to amass as many people's medical records as possible as a part of his autism study, and this has me a little bit concerned because there are more questions than answers at this point. But according to CBS News, based on comments that were made at a meeting recently at the National Institutes of Health with their director, apparently they're going to try to take these various data sets that include health data from private and public insurers like at the VA and Indian Health Services, at pharmacies, genomics data, as well as smartwatches and fitness trackers. They're going to take all that data to try to come up with some type of conclusion as to what is the underlying cause of autism, and we're supposed to have some answers by September. But what I don't understand based on this reporting and what is going on is how are they going to handle the privacy of this data? According to this article, roughly between 10 to 20 outside researchers will be chosen to get grant funding as well as access to this data, but it's unclear how they're going to get chosen and how well this data is going to be kept safe. Because all I can see here is that according to the NIH director, Dr. Jay Bhattacharya, while they will be able to access and study the private medical data, they will not be able to download it. He promised state-of-the-art protections to protect confidentiality, but that doesn't really give us much information that would be in line with HIPAA privacy laws. So are they going to truly de-identify this data so that the researchers aren't going to know who they are looking at? What are the measures that they're going to put in place to make sure that this data is safe? Because this is our personal health information at stake. Health and Human Services talks about how they're going to have radical transparency, so I'd really like to know how our personal health information will be kept safe throughout this process. And if I hear anything else, I will let you know in the future. RFK Jr. is trying to amass as many people's medical records as possible as a part of his...
A lot of y'all were really concerned about Roe v. Wade being overturned because of the abortion part of it. And yeah, the abortion part of it is obviously catastrophic because abortion rights are human rights, right? Everybody should be able to do what they need to do with their body. It should be between them and their doctor, okay? However, the hugest part of Roe v. Wade was your right to privacy. So with all of those comments that are in the videos are like, is this not a HIPAA violation? Yeah, it is a HIPAA violation. But Roe v. Wade being overturned means your right to privacy is no more. No more. And let's also keep in mind, when you talk about right to privacy, it's not just your medical records of what's happening between you and your physician, but it's also whatever goes on in your home. Because anal penetration was considered illegal in a lot of places. But regardless of your gender, regardless of your sex, regardless of like whatever it is that you do in your home, it was considered illegal. So your right to privacy, your choices as a human being, that was all tied up in Roe v. Wade. That's why they're able to collect data now. There's going to be a lot of people who voted for that orange man that are going to be like, oh, well, we didn't want this. We just wanted, we're just pro-life. Yeah, well, see what happens when you align yourself with white supremacy? You get eugenics. You didn't see that one coming, now did you?
Why is autism suddenly becoming the #1 priority for Health and Human Services?
It's just simple eugenics. They could start with other disabilities and they're choosing not to. And they're choosing not to for a reason. Because they could start with, cerebral palsy, multiple sclerosis, a whole bunch of other disabilities. But they originally started with the farms in ADHD and autism, but mostly the autism, because there's no other disability or disorder that is linked to being a trans person other than autism. Yeah, there's a correlation. There's a correlation between autism and being a trans person. And they have hyper-focused on trans people. So, that's where that's from. That's why. That's why they're so focused on autism. Because they're that focused on trans people. And it all boils down to wanting to rid the United States of anyone who is not white, straight, and male. I mean, it's pretty plain in what they're doing. They're taking moves straight out of the Mustache Man's handbook about paying women to have children and giving medals for women to have children. They only want certain women to have children, though. All of these rules, all of these laws about women's bodies, about uteruses, about all that is to control white women. White people with uteruses. They don't care about the rest of us. They don't want the rest of us to have children. Not unless those children are going to be able to go into the school to prison pipeline. Which is another reason why, you've got them saying that they're forcing people to pay student loans, and it's people who can't afford to pay student loans, and then they're going to garnish their wages. And then with garnishing their wages, well, guess what they made illegal in a lot of states? Poverty. Being homeless is illegal. It's why they're doing that thing with the banks where, you're going to get charged if you don't have money in your account. If you make poverty illegal and then you force everyone to become poor, and we still have those laws on the 13th Amendment that says that if you are in jail, you are free labor. Yeah. Everything is boiling down to eugenics and chattel slavery. Every single thing they're doing. Every single thing. It's blatantly obvious. At least it is to me.
I want you to hear what I'm saying. This is not fear-mongering. This is to increase awareness. The type of rhetoric that is being used and that was used by the person who is currently overseeing HHS, that type of rhetoric about people with autism, that type of rhetoric is eugenics. That is eugenics at its core. And the rhetoric that is being used to describe people with autism, that is eugenics. And we've seen this type of rhetoric before throughout history. And they've done this before to justify inhumane actions against people. They've done this before to justify inhumane actions against groups of people. That is eugenics-like rhetoric. This is how it starts. I'm not trying to scare anyone, but this needs to be discussed because it's serious. When people start to use rhetoric surrounding a group of people not contributing to society, or to try and use code language to talk about how they aren't able to really fit in society, that is eugenics. And we will not allow it. We address it every time we see it, every time we hear it, because that's what it is. That is what it is.
Autism, this epidemic is only happening in our children. It's not happening in people our age. And if it was better recognition, you'd see it in 70-year-old men. And I'll say this, I want to be very careful when I say it, because I've never seen a person with full-blown autism. I've seen many people with Asperger's and, on the spectrum who are my age. I've never seen anybody with full-blown autism. That means nonverbal, non-toilet trained, etc. You don't see these people walking around a mall because they don't exist in our age.
Watch my brother's video. But here's what I see coming down the pike, right? With the impending dismantlement of the Affordable Care Act and all health care and all that stuff like that, right? And the key thing that that he's talking about is this. Kennedy's rhetoric on autistic people is basically going to pull the rug out from people who are right now having the healthcare company, even Medicare, Medicaid, cover mental health services. And especially, children who are autistic who get therapy and speech therapy, occupational therapy, and stuff like that within their healthcare plan or even within schools in partnership with the Department of Education. That is going to stop being covered if they get their way. And this is the rhetoric of eugenics, as he said. Do you know why? Prior to, I would say the 80s, late 80s or so, and then the 90s, you didn't really hear, it didn't seem like if autism was much of a problem when you look at the mainstream media. You know why? It was because for a lot of people who are autistic on the spectrum, who are, on the less functional part of the spectrum, God, I can't even bring myself to say this. A lot of people were simply institutionalized for the rest of their lives, subject to all kind of horrible treatment the rest of their life. This is what he wants. This is what they want to go back to. Again, them calling out people on the autism spectrum like this, it's like they consider them wasteful. They consider the resources used to treat them or to take care of them as not worth it. So what do you do with people? What do you do when you think resources are scarce? What do you do with people who are wasting resources? This is why what he said bothered me so much, because I'm a parent of 2 kids who are autistic.
If you've already gotten an autism diagnosis and you are concerned about RFK Jr.'s disease registry and how he's going about doing this, what information might be pulled in, this one's for you. First up, your HIPAA rights. You have the right to see your own records at any time. You also have the right to ask for corrections. Now, that doesn't mean they can just delete things because you don't want it in the record anymore, but if something is no longer true or correct, you can ask for a correction. You also have the right to ask for a list of anybody who has had access to your record. Number 2, ask about opt-out options. There are some things that we opt into that you may or may not even be aware if you're opted into regarding sharing your data for research purposes. Opt out of everything that is not medically or legally required. If you get any kind of new consent form, don't sign it unless it is absolutely required to get your disability pay or to receive care. If they're asking for consent for you to release any kind of data, no matter how harmless it seems, I would not sign it right now. And last one is be really careful with any kind of digital health tools, whether you have an Apple Watch, a smartwatch of any kind, whether you're using any apps to track any kind of health information. But be very aware of what you are tracking and what the privacy policies of those devices or apps are. This is one of the areas that has some gray areas around what is privacy, because at this point you're outside of HIPAA laws. And JFK Jr. has said this is one of the areas that they want to look into for looking for this data that they want for their autism research. So if you have any kind of wearable devices, if you have any kind of apps that you use that are tracking any aspect of your health, either check the privacy policies, check any sharing policies, and or change what data you are sharing, or potentially even move out of any kind of electronic tracking back onto paper systems if you feel that is where you need to go. And it sounds like there are some autism advocacy groups that are already monitoring the situation and trying to do what they can to change or shut down this entire concept and all of this research. So I don't have any great specifics on that right now, but definitely look around, get involved if you can in some advocacy to make sure this database, this registry, this research gets shut down.
If you live in the state of New Jersey and you have autistic children, just know that they keep a list. They keep a list of who is diagnosed with autism. You're automatically put onto a registry. You have to opt out of that registry within 30 days of your child being diagnosed with autism. Like, you have to sign paperwork that says that you do not want your child's name or date of birth or any of that information put on the registry. And they say it's so that autism services can be allocated to certain areas. They can do that without having your child's specific information. And they've been doing this for a couple years now, I want to say. And I did not know. I switched pediatricians, and the pediatrician sent me a warning saying that we have to let the state know, and I immediately shut that shit down. So if you have kids that are autistic and you live in New Jersey, please know that your pediatrician has most likely already let the state know your child's name, date of birth, and address, and put them on the autism registry, which very much immediately gave me the ick. And this was prior to the orange man being voted in. So